when I was looking for a political party to join, I had a big choice. I had the Green Party, I could have joined the SNP, I could have joined Rise, I could have joined one of the communist parties, I could have joined the SW. Like, there was a whole bunch of parties that I could have joined. They're all left of centre, I was left of centre. I think the only thing that separated me from anybody else that was left of centre was being explicitly, offensively anti-war. Except even that's no different anymore because the SNP are anti-war. But at the time, I had Labour. Labour was the thing. So that's what I want to talk today. That's an original policy. So the reason why I didn't like the current system is terrible. That's the main reason. So I'm going to go through a few reasons how it's terrible. I'm a big fan of people using medications if they need them. So I know some people prefer a more natural lifestyle. If they've got a cold, they'll fight through it as opposed to taking cough medicines or whatever. I'm of the opinion that if you need a medication, go and take it. But I realise that this comes at a cost to the NHS and it's quite pricey. So the right-wingers make the case that what's required is a free market. They want competition involved. They think if a bunch of companies are fighting with each other, prices will come down. So I've got the complete opposite view. I think that the problem with the pricing is that private companies are involved already. So I'm going to explain now how companies make things more expensive. A bunch of you will have heard this, one of these examples already, because I've used it a bunch of times. But to the NHS, there's a moisturiser worth £2, and to the NHS it's sold for £1,600. So there's going to be more than one of these tubs of moisturiser being sold to the NHS. Let's mark up the price. I don't know how many things are sold, but that's 800 times more expensive than it's actually worth. That's a huge cost to the NHS for no reason whatsoever. There's also a prostate cancer treatment, which realistically could cost £11 a day, but to the NHS, because a private company is involved, it costs £98 a day. There's also a leukemia treatment being sold for 22 times the cost. I tried to look for the actual numbers for that, but all I could find was 22 times the cost. That was the best I could find. So in fairness to the NHS, they have tried to save money by using sort of generic medications as much as possible. So for instance, you get fluoxetine instead of Prozac, or sertraline instead of Zoloft. It's maybe telling that my two examples are antidepressants are again. But the Tories are obviously going to start using these things as an excuse to start privatising things, to start bringing more companies for the reasons I stated earlier. They like the free market. They think competition is going to make things more positive. And obviously I totally disagree with that, and I'm scared of the day that they try and implement a US-based health system in the UK. And the reason why that is, this is the bit I was talking about earlier with the homemade medications. There's a group organisation, I don't know what they call themselves, it's called 4thievesvinegar.org. I don't know why. They've got online tutorials on how to make an EpiPen and how to make a couple of different really expensive medications. One of the medications that they've got a recipe for costs $80,000. I don't know if that's per pill or per box, but $80,000 is how much this medication costs. Now that obviously scared me to death. I did like thought, like one of the tutorials is a homemade lab that you can build in your house, and then you just buy stuff for the chemist or whatever, and then you start making these wee chemical concoctions in your house, and then you start taking your own medicine. I do like the sound of that. Hopefully no one else likes the sound of that either. That terrifies me to death. Right, I appreciate what they're going for. A lot of people in the US can't afford these medications. There's people, I think Ron touched that at another branch, that there was a guy who was diabetic. He couldn't afford his insulin, and he died because he couldn't afford it. So I appreciate what these guys are trying to do. They're trying to get medication for people who are poor, but I worry that somebody's going to go out, try and get the recipe for this, substitute something that they can't find, and it's going to go all badly. I do like the thought of that at all, so I never want that to happen. So our suggestion, our alternative, is to make a publicly owned pharmaceutical company to produce generic medication for the NHS. So the pros of this are that you could obviously keep it free at the point of use. Hopefully it will be a UK-wide thing. Obviously outside of Scotland they have to pay for the prescriptions, it's still subsidised but they have still to pay for it somewhat. I think Northern Ireland's free, I'm not entirely sure. But it'll be kept free at the point of use for us at least. It'll be much cheaper for the NHS as it's non-profit. As I say, these private companies, they go in, they get a contract and then they start marking up prices. And then you see the examples that I gave earlier. They just keep marking it up and just make tremendous amounts of profit. And most of it is going to shareholders, most of it isn't going to the workers, most of it isn't going to advance the technology, most of it is just going to shareholders. This is a worry that some people have. Not sure if I believe it. I guess there's some truth to it. There's a lot of people who think that pharmaceutical companies withhold cures. I don't know if they do, no idea. I'm not inside, got no idea. But in this case, because it's non-profit, there's no benefit to withholding medication. There's no financial profit, there's no waste, there's nothing, there's entirely zero benefit to withholding any of that. So there'll be no reason for it. Any extra money raised, hopefully, at some point, obviously the NHS will be paying for it, so it would all be government money, but any extra money given to the pharmaceutical company for these drugs could then either be put back into the NHS if they don't use it, or they could be used to advance technology in other areas. This would obviously create a lot of jobs. Right now, Boots, 41% of their income is generated by the NHS. That's just through NHS contracts. So if you were to have a public pharmaceutical company that overtook all NHS contracts, Boots would lose 41% of their custom. A bunch of other pharmaceutical companies would do the same. So that market would then be opened up for the public pharmaceutical to make more jobs and to increase things. When you start to make public companies bigger, especially non-profit ones, private companies are inevitably going to start to lose. They can't keep up with it. Again, people say this free market thing works because, oh, I'm going to beat you by making my prices cheaper. Well, if you do that, I'm going to make my prices cheaper. That's cool for a wee while, but it's not sustainable, so they can't keep it up. Whereas if you're not looking for profit, you can keep it going forever, because that's just your default position. So private companies are not going to be able to keep up with that. Eventually private companies are going to start failing, and then that will open the market up even more for this public pharmaceutical company. Eventually, hopefully, all things going well, you're looking at a publicly owned pharmaceutical industry as opposed to just one company. That's the ideal scenario. If it gets to that situation, you're looking at this publicly owned pharmaceutical company producing pills for the private healthcare, like Bupa. Bupa already costs the NHS money. So if you're talking the public pharmaceutical company being sold to these, or the products for this company being sold to people already willing to pay premium prices for their healthcare, that's more money going into this public company. In which case it would be more money either going to the NHS or going to improve the technology. Another thing that's I think is mostly a fear in America, might be slightly over here as well. A lot of people worry about advertising campaigns and overdiagnosis, especially of things like depression and things like autism. A lot of people think that autism is overdiagnosed because it's so easy. Because it's so easy to start giving people treatment for these things. And depression as well. If you find something that's sad, you target an ad at them saying, oh, you need antidepressants, then they start making money through that. Again, I don't know if that's true, but that is a fear that's brought up. I figured I'd touch on every aspect of what this could improve on. So, in summary, Solidarity is innovative. We've got original policies, and that's part of the reason why I was inclined to join. The mixture between public and private costs the NHS way more than it should. People are starting to come up with homemade medications which we want to nip in the bud pretty quickly. And our suggestion would create jobs, save money, improve living standards and offer additional funding in other areas.